Hello, my name is Danae Hofert and I am a board-certified music therapist. And today I'm here to talk to you about what music therapy is and how it may be effective in treatment for pediatric burn patients. According to the American Music Therapy Association, the most recent definition of music therapy is as follows. Music therapy is the clinical-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. A music therapist must complete 1,200 hours of clinical training as well as take and pass the board certification in order to become a board-certified music therapist. The Certification Board of Music Therapists grants this certification, and once certified, a music therapist needs 100 continuing education hours every 5 years. Music therapy interventions may address 5 need areas for pediatric burn patients, which include, number 1, physical needs. Example of this may be pain management. Number 2, social needs. For example, this may be increased family interaction and social support. Number 3, psychological needs may include emotional expression and reduction of anxiety and agitation. Number 4, cognitive needs. For example, improving orientation and neurological functioning. Number 5, communication needs. An example of this may be increasing language skills for pediatric patients to better express themselves and what they may be going through during treatments. The use of music therapy in treatment for pediatric burn patients has been studied by a number of researchers and was found to be effective, as seen in the following studies. Edwards, 1998, conducted 5 case studies on the effects music therapy had on the needs for pediatric patients as they received care for severe burns. In all 5 cases, the researcher used songwriting techniques during treatment. Interventions included story songs about toys improvised by the patient and supported by the therapist. Music therapist improvised songs based off of story dramas created by the patient through play, collaborative songwriting with family members, songs written by the patient and the therapist about hospitalization, and new lyrics written to familiar songs. The results of this study found that the use of songwriting techniques aided children in psychological support, self-expression, and helped children find ways to cope with difficult situations. Family involvement was found to be useful in expressing the concerns and feelings of caregivers, as well as support family interactions among family members. The researchers discussed the importance of offering children choice and control over the level of participation during the songwriting process. Davison, 1999, conducted a study on the effects music therapy can have during debridement. She conducted this study over a 6-year period, collecting data on burn patients 18 months to 15 years old. 20 of these patients received music therapy at the bedside, while 3 children were part of a music therapy debridement program. From this study emerged a 3-stage music therapy model for debridement. Stages were based on emotional and behavioral responses, as well as coping strategies patients used during debridement. There was not a particular order that the patients progressed through the stages. However, responses differed for patients over their course of treatment and were not based on a single debridement procedure. Stage 1 was based on fear. The music therapy interventions utilized distraction, diversion, and reality-focused techniques. Emotional expression was the basis for Stage 2, validating techniques and music therapy interventions that focused on self-expression were used to provide patients opportunities for control and choice. The 3rd stage was based on resistance. Music therapy interventions utilized relaxation techniques and techniques used for patient orientation. The results of this study found that corresponding music therapy techniques helped to assist in minimizing pain, anxiety, and distress. It also helped to increase the patient's use of coping strategies that were effective and assisted patients in finding a positive locus of control. Music and imagery relaxation interventions were used during the study. Other specific music therapy techniques used throughout this study included receptive listening of familiar songs, sang to the patient by the music therapist, singing of new lyrics to preferred songs about what was happening in a procedure or as a way for the patient to ask questions about the procedure, relaxing guitar improvisations by the music therapist, as well as changing the dynamics of familiar songs and inviting the patient to add new words to songs to aid the patient expressing pain and anxiety during debridement. Whitehead, Plox, Zebraux, Berries, and Sheridan 2007 also conducted a study on the effects music therapy can have for pediatric patients during debridement. They studied the effects music therapy had on levels of anxiety and pain for 9 pediatric patients during debridement. Both psychological and physiological tests were used to collect data. Improvised songs and patient-preferred music were used during music therapy interventions. The data indicated that music therapy reduced anxiety, stress, and combative behaviors. According to interviews with patients, families, and medical staff, music therapy was helpful in reducing pain and anxiety and assisted patients in relaxation. It was also reported by family members and nursing staff that music therapy helped them to relax as well. As seen by these studies, music therapy uses innovative music therapy interventions to promote healthy coping skills, to validate emotional expression, and to meet the needs of pediatric burn patients. Now I will show a sample music therapy intervention that could be used for pediatric burn patients. Thank you for your time.